So 1 in 4 people listening to this right now probably have a tongue tie. And then it doesn't go away. It doesn't stretch out. People, it's a common misconception. It won't stretch out. It
Hmm.
just changes over time. The symptoms will change. Several singers, and they noticed they could sing easier, less muscle tension dysphonia. I'm not as familiar with that. I'm not a singer, but people report for singers they can like hit higher notes than they could beforehand. This one kid, he came back. He was so cute. He's like, I hit the high do. He was like super excited. His vocal range changed. Easier to sing is what we often notice.
Kia ora and welcome to Singers Having Coffee. I'm your host, Zoe Stebe, and today's guest, Dr. Richard Baxter, is a board certified pediatric dentist and he is an internationally recognized speaker on tongue ties. He's also the author of the best-selling book. And the reason why I asked him on this podcast, because I read his book, well, I was listening to his book, and I sat there in my car crying as I was driving down the highway because his book, Tongue Tied: How a Tiny String Under the Tongue Impacts Nursing, Speech, Feeding, and More, changed my life. It changed the way that I look at my voice and what happened in my past with my tongue tie issues. And I am so thankful that he has come on the podcast today. Unbelievably, it wasn't until after Dr. Baxter's education in dental school and pediatric residency and his immersion in the dental field that he discovered his own tongue tie. And the fact that it went undiagnosed for so long himself helped him to recognize that others were living limited lives because of their tongue ties too, including his 3 daughters. So now he's on a mission to help parents easily identify issues associated with their children's mouth restrictions so that they can get the right treatment sooner. And that's exactly why I invited Dr. Richard Baxter to join me today on the podcast, because I'm also on a mission to educate singers and those out there about tongue ties and their effects on the singing voice. So let's get straight to the episode. I'd like to welcome Dr. Richard Baxter to the podcast. Thank you so much, Dr. Baxter, for joining me today on Singers Having Coffee. I recently had my tongue tie released, and
Okay.
I only found out about last July that I had a tongue tie. And since I've found out, I've basically dived into all of the information about what it is, how it affects the voice, and things like that. And I was reading your book, Tongue Tied, and I think I'll link it down in the description. I think every musical professional singer sing exactly tongue tied. This book is fantastic. And I recommend it to all of my colleagues because I think it's one of the best books out there that gives us a very clear idea of what's going on from infancy all the way even to adulthood as well. And I think that's one of the reasons why I asked you here today, because
Yeah.
I think that there's not enough talk out there about adults and tongue tie and what the experiences are for adults.
Yeah, there's really not. And even until like a couple years ago, the only article was from 1993 from Japan. It was like 3 or 4 adults, and that was it. But they don't stretch out or go away with time. And so for sure, it can affect little babies, affects children. That's my main area is the babies, the toddlers, school-age children, some teens, and I used to do adults. I don't anymore. I'm a pediatric dentist, and so I realized it's probably better just to stick with what I know. But yeah, we did several tongue-tied singers. We had some opera singers. We had one guy in like a Grammy Award-winning band called Zach Brown
Wow.
Band. I can tell you that because he did a podcast and told people. But and then we've had Diary of a Tongue-Tied Singer. She talked about it as well. I'm not sure if you've seen her thing. Her name
I
is Leah.
have, yeah. She's
Yep.
fantastic.
So
Yeah.
it's on YouTube if you look it up. And her husband is also like a vocal coach. And so
Hmm.
it was cool. I made the mistake of asking them, like, can you sing a little bit and test it out? I was not expecting that. It was really loud. Full volume, I think they call it. And like our rooms are not set up for that kind of sound. So it wasn't like breaking glass, but like almost, you know.
I can imagine in
Anyway,
a doctor's surgery because there's like lots of, obviously there's not a lot of soft furnishings. So as
yes.
soon as an opera singer sings in
Like,
there, they're just like,
oh my gosh.
yeah,
I
exactly.
was
It's like
not
singing in the bathroom,
but she was like super excited right afterward. A huge difference she noticed. And yeah, several other opera singers too.
Wow, that's incredible. I definitely the person that I went to here in Munich who did my tongue tie release, she got me to even just look up at the ceiling. We did the difference in the measurements of that one of
Yeah.
the ceiling, and I was like, "Oh my goodness me, I can look at the ceiling without pain." I
Yeah.
thought it
Or
was
check
just
your blind
totally
spot.
normal.
Like when you're driving, it's easier to move. It's the fascia release. And so a lot of the stuff that helps with singing, it's kind of similar as that. So,
Exactly. Actually, that was something that I did really notice because this is one of the really simple movements we get singers to do to release the tension inside the throat if there is any.
mhm.
And yeah,
Up and
absolutely. That
down.
sort of
Yeah.
movement up and down. It's just absolutely crazy. I wanted to just start with what is a tongue tie for those listening and for those watching who don't actually know what a tongue tie is.
Yeah, so like in the book, it says how a tiny string under the tongue impacts nursing, speech, feeding, and more. And string is like selling it a little bit short, but we're trying to, for people that are like, what is a tongue tie? It's the piece of skin or string under your tongue that restricts normal tongue movement. Otherwise, it's just a frenum or like a frenum or a frenulum. There's all these different words for it. And so it can be attached to the tip, would be an anterior tie, or it could be like less than 50% to the tip. That would be more of like a posterior tie, where the middle of your tongue is held down. And so those can be less obvious. And then people often don't realize that they have it. So someone listening right now or watching us could realize, oh my gosh, as we're talking, like, I have one and no one picked it up for 30 or 50 years.
Hmm.
And so we'll get into it later, like why they go undiagnosed. But basically, yeah, it's just a restriction in the tongue. And so it's kind of variable in appearance, how thick it is. It's often a collection of mucosa, which is the top layer, like your skin. So in the mouth, it's called mucosa. Under that is the fascia, so it's a connective tissue,
Hmm.
like the stuff you pull off a chicken, stringy stuff. It holds us all together. And then often there's muscle inside of it too. It just depends. This actually it's pulled up inside the frenum. And then so it's partial like a genioglossus, the muscle underneath there.
Hmm.
That's what when you expose it, you see that muscle. But sometimes that gets pulled up in the frenum itself. So anyway,
So that was actually because the genioglossus is a muscle that we talk about a lot in singing about the movement of
oh
the
great,
tongue and about
yeah,
the restriction of that movement. Then, if so, sometimes the genioglossus can actually get pulled up inside,
part
like
of it. It's a big muscle, so it
yeah.
just be part of it. So sometimes we make a partial release of the genioglossus.
Hmm.
We try to be pretty conservative because the more of the muscle you take, the worse it hurts. It can also scar down more. So, but sometimes, yeah, it's actually pulled up inside of it on babies or kids. You'll see it. So as
Wow.
soon as you enter into the frenum, it's like you're already in muscle, and then the tongue still doesn't lift up at all. So you have to get a little bit of muscle, but
Mm.
that's probably 1 in 100 cases we do. Maybe a few out of 100. So.
Okay. Oh, my goodness me. I think a lot of people that I've spoken to since they've sort of said, "Oh, but it didn't look like you could still poke your tongue out quite far."
Yeah.
Um, is
Yeah,
it a
so they can
case of
often stick the tongue out. Yeah, that's not the best test. So that's actually the worst test is sticking the tongue out. And so that's
okay?
why they go undiagnosed because the doctor, the physician will ask you to stick your tongue out to check your tonsils, to check the back of your throat, make sure you don't have, a strep throat or something. They're not checking tongue mobility. So if you stick your tongue out like that, they'll say it's fine and just like comes to your lip. That's not near, I mean, it should come,
Mm-hmm.
halfway down your chin or more, like Gene Simmons. But actually the best test, more diagnostic, would be lifting the tongue. So
Ah.
if you open as wide as you can and then lift the tongue, yeah, yours looks good. So you want to lift up all the way, and you should be able to touch behind your top teeth, so the incisive papilla, with your mouth open like that. And then some people compensate too. So some people are lifting the floor of the mouth up with it, so it's like you're standing on your tippy toes.
Mm-hmm.
And so some people can still touch the top. They open wide. Another thing is some people can't open that wide too if they have TMJ issues. But so you should be able to open wide, lift the tongue up without compensating. So sometimes we'll hold the floor of the mouth down if they're compensating, and then you get a true picture of where it is.
That's something you
But
outline actually in the book, isn't it? That you say to hold down the bottom of the tongue if people want to experience what it's like to have a
yeah,
tongue tie, maybe if they
you can do
don't.
that too. Yeah, you
Yeah.
can hold it down and try to sing or try to talk. But I mean, so the opera singer we treated, she was 39 years old. She had
Mm-hmm.
sleep issues. So it's not just isolated singing typically. She had sleep issues, a lot of anxiety, reflux, constipation, a lot of neck tension, that kind of stuff, posture issues, like a forward head posture. And her tongue did not look bad. So, like in the mirror doing that test, she could lift pretty well. She was probably lifting like maybe 75%, But if you hold down, now it was like less than 50% she could lift up. So that was her true mobility. She couldn't lift up very well. So we treated her tongue tie. It takes about like a minute or two to do it with the laser. And then we stitch it up for adults with like some resorbable sutures. And then, yeah, like a week later, she said singing is easier. Her posture's better. Her like stress anxiety got better. Her sleep got better. And she was super happy. She was, yeah, an opera singer, like your people that listen. And also people notice they can sing without fatigue. So
Mm-hmm.
often it's like vocal fatigue.
Yeah.
But even like for me, when I was reading children's books, my kids would ask me to read it again, read it again, read it again, like Chicka Chicka Boom Boom or something. And it was like, I don't want to read this book again because it's so much effort to talk.
Mm-hmm.
So it's easier to sing. It's less effort to sing, less effort to talk even. It's easier to breathe, people often report. So all these kind of things, you're fine. Like you'll live with the tongue tie, but like could be better. Like you could thrive instead of just like surviving.
I'm really confused why is this, as you say, the tiny string under the tongue, why does that impact vocal fatigue and breathing so much?
Yeah, so imagine if you're trying to walk and your shoelaces are tied together. It's like so much effort. It's like, I'm not going to walk over there. That's too far, right? I'm not
Mm-hmm.
going to walk to the park. I'll walk across the room, but I can't walk to the park because I can't hardly move your shoelaces. Same thing. So if your tongue is held down in the floor of your mouth, you physically can't move it easily. It's a lot of effort. Maybe like if you had a rubber band around your ankles and tried to walk, like one of those TheraBands, and try to
Mm-hmm.
walk around with that, it's like so much effort to do that. Like I'll just sit there. So for the babies, we'll see it. They'll fall asleep when they're latched to the breast or on the bottle. They'll fall asleep, but they can't finish their feeding. So it's so much effort. The kids, they like won't lateralize their tongue to eat, and so they'll take two bites of hamburger and say like I'm full, or they'll spit it out, give it back because they can't swallow it well. The babies will have there's tons of issues we can go into, but and then it doesn't go away, it doesn't stretch out. People, it's a common misconception. It won't stretch out. It
Mm-hmm.
just changes over time. The symptoms will change. So because they're not nursing anymore, then they're not like the little kid stuff where they realize like, well, I just can't eat meat, so I'm gonna be a vegetarian, right? Or that
Uh,
happened one time. Like I just don't, I just avoid meat, or I just eat chicken nuggets because it's easy versus like a hamburger. We were in Switzerland, Germany, went to Austria around there, and it was beautiful. Went to Neuschwanstein castle
that's
there.
about 30 minutes away from me.
Yeah, yeah, it was beautiful. It
Yeah.
was really
Oh, I
cool.
love
And went
that.
down to Innsbruck and then back to St. Gallen, Switzerland, where we had a conference, a tongue tie. It was the largest international tongue tie conference back in January. It was super cool.
Oh,
So they do have
wow.
like tongue tie conferences. It's a thing. Yeah.
Yeah, well, I mean, it's interesting actually because I only it happened to be that I was at this masterclass with a singer talking about her tongue tie release, and I was just going through all of her symptoms. I was like, oh, vocal fatigue, can't hit the notes, not pitching
Yeah.
properly, all of these like head and neck, shoulder issues, people telling me
Yeah.
to bring my tongue forward the whole time, not being able to do that,
Yeah.
muscle tension
Yeah.
dysphonia, like all of
Yes.
the symptoms.
There's an
Um,
article now on muscle tension dysphonia that Robin Walsh just put out. Yeah, and tongue
really?
tie. Yeah, and singers. Yeah, you can look it up. Robin
Okay.
Merkel Walsh is the author's name. Dr. Zaghi, I think, participated in that one as well. But they had several singers, and they noticed they could sing easier, less muscle tension dysphonia. I'm not as familiar with that. I'm not a singer, but and then yeah, but people report for singers they can like hit higher notes than they could beforehand. This one kid, he came back, he was so cute. He's like, I hit the high do. He was like super excited. His vocal range changed. Easier to sing is what we often notice. Like relaxing the hyoid and sing. I don't understand all the full range of singing improvements, but they seem to like it a lot whenever you do it for an opera singer or even like the guy in a country music band. And for him, I said, did it help your singing? He's like, not really. I'm like, all right, they're Grammy award winning singers already. Um, but he said, you know what? I can breathe better. I said, well, you breathe more than you sing, actually. He's like, my stress level's down like 20%. Was that
Wow.
good? It's like, that's like life changing. It was like way, like just took like a weight off his shoulders.
Wow.
So he was super happy with it. hmm
That
So,
is incredible. Well, because the tongue, I mean, not telling a medical professional about the tongue connecting into the hyoid bone, so then that
oh
helps us
yeah,
with raising our larynx and being able to hit higher notes.
yes.
I definitely noticed I'm able to hit much higher than I was before. And I had pretty much for a long period of time lost a lot of the top of my range. And
Yeah, it's
people would
all
just
connected. Yeah, it's all connected in there with like literally the muscles are right straight connected, but also the fascia is connected from your tongue all the way down to your toes, actually. It's called the deep
Wow.
layer of investing fascia. So when we release it on a baby, for example, we'll notice they can do tummy time better. They can lift their head up better, even the babies. They'll start walking or crawling within a day or two after the release. Not always. We don't guarantee it, obviously. I'm not God. I don't know. But we've had some 18-month-olds, right, that are not walking yet. At 18 months old, they should definitely be walking. We do their tongue tie release and lip tie or whatever they need and start walking the same day or the next day. It's pretty wild. Kids that
Wow.
are 12 months old and not crawling at all, like they should be crawling certainly by 12 months. We do it the same day or the next day, they start crawling better or start like moving better. It's pretty wild. So that's the fascia, that's the connective tissue.
That is so amazing. I think we're really like starting to learn so much more about what fascia is doing and what it can do. And
Yeah, it's underappreciated. It's kind of just what you cut through to get to what you want to go to the lungs or the heart or the GI system. Like, the surgeon just cut right through it, no problem. But no, it's pretty amazing.
that's incredible. Why does it go then? I mean, this sounds incredible. And actually, a lot of people say to me, like, Zoe, there's no way that it can be like this beneficial for you having had the tongue tie release. But why do these things end up going undetected then for people
Yeah.
who do experience? Because in your book, you also talk about infants having difficulty feeding. And I, for example, had difficulty feeding. I was literally like listening to the infant part as well because I thought this is extremely interesting. I had grommets,
Yeah.
I had lots of operations, lots of antibiotics.
Yeah.
Everything you were describing, I'd gone through as well. Why does this still go undetected then?
Yeah, it's wild. So basically, it's a systemic lack of education on the subject. So they
Okay.
don't teach it in medical schools, dental schools, like residency programs, speech therapy programs don't teach it. So the American Speech and Hearing Association, ASHA, says there's no connection between tongue tie and speech. But like, so we do a 2-month-old for feeding reasons, and they come back a week later, and mom said, oh, they started babbling more the same day, the next day. They're talking more, new sounds. That's not a placebo effect. You don't get a placebo effect on a 2-month-old like that. Anyway, so the older kids, speech delay, they have like 3 or 4 words. We fix their tongue tie. They come back the next week with 10 words. Like, oh, it's a coincidence. No, it's not. It was the same day. It's like
Mm-hmm.
you put some cookies in the oven, they turn brown. It's that effect. We have studies on that actually. So our study from 2020 was the first study to report changes in like speech delay, picky eating, choking on foods, restless sleeping, snoring, and tongue tie in kids. And those had never been reported on previously. And actually, our 2018 study, Baxter and Hughes 2018, so it goes over. I was working on the chapters for the book, and so we try to bring as much research as possible into this. It's not being
Mm-hmm.
done in a vacuum. So I did the speech chapters and I did the research on it, like the sleep chapters and the research. I got to feeding, solid feeding, and like the babies, there's lots of research on babies. Solid feeding, there was this many articles. There was 0 articles on solid feeding and tongue tie. I said, I have nothing to even put in the book. So we put together just like five patients, a case series of less obvious, like a posterior tongue tie. And they saw improvements in speech and solid feeding within even a week. And so we put all that into an article and published that. And that was the first article ever published in 2018 on solid feeding and tongue ties. So pretty crazy, but it's just no one's doing the work out there. So it's kind of like word of mouth. Why is it being diagnosed more now? Probably, it's more awareness of it. So like Facebook
Mm-hmm.
groups, Instagram, TikTok, people hear about it. Um, there's the good and the bad. A lot of people think of it as being overdone or overtreated. If it's a quarter of the patients, like 25% of patients, which is like a conservative estimate, so 1 in 4 people listening to this right now probably have a tongue tie. It's severely undertreated. Now it's more than it used to be. So people are saying, oh, the New York Times put an article, The Booming Business of Cutting Babies' Tongues.
My
That
goodness
came out
sakes.
like a few days before Christmas, I think 2024. Thank you so much for ruining my Christmas there, New York Times. Um, and I wrote a response to that. And what's cool is if you Googled like booming business of cutting baby's tongue, my response for a while, I'm not sure today what it would be, but actually popped up above the New York Times as far as like, yeah, on Google of the response to it. So anyway,
Fantastic.
there's a lot that goes into it. We're trying to help educate people with the book. Now we have it, if your listeners, I mean, if they speak German, we have Zungenband.
I've
Uh,
seen that. It's also
yeah, it's
available in
in
German. Yeah,
German, it's
Zungenband
in
is fantastic.
Italian, lingua legata, it's in Spanish, lingua atada, it's in French, frende langue. It's in Polish, język na uwięzi. Probably butchered that. Język na uwięzi, I think is how you say it in
Wow.
Polish, which is not at all how it's spelled. It's spelled like język na uwięzi, but and then it's in Chinese now, Sheshi Dai. It's in Japanese. We have it in 12 different languages.
Hmm.
So anyway,
I think it's such a fantastic resource for people who are, I mean, as singing teachers and singers, we sit at the source of people who are having these types of issues with their bodies. I, since reading your book, have now spoken to, I mean, I have like 55 singing students. So according to the numbers, there should be
yeah,
around 10 or
10,
11, right?
15 could,
Yeah,
yeah, could
10 or
easily have it.
15. And
Yeah,
so
and
I,
25 is a conservative estimate. Some people would say 32.5%. Um,
wow.
but if they're seeking out your help and they've had struggles with their singing in the past, it could be even higher. So it's
Hmm.
like a self-selecting group. So like for speech therapists or for feeding therapists, a friend Autumn, she's in South Carolina, Autumn Henning, she has like a TOTS course. And she says like of her patient load, they're not coming to her for tongue tie. They're coming for solid feeding issues. She said 90% of her caseload has a tongue tie because like the kids that are slow eating, picky eating, they're choking on foods, gagging on foods, those kids have tongue ties. So they're going to seek out those problems. So I mean, they're trying to better the career. That's their instrument, right? And
Yeah.
so you can't just get like a new guitar, a new piano. You want to optimize the instrument. And so the more free the tongue is, the easier they can yeah sing. Then sing for long periods of time, like opera singers do.
Hmm.
At very very loud volumes. What we've
Hmm.
seen with kids is they'll mumble, they'll kind of talk like this, or almost their teeth together like that, because if you can't move your tongue very much, you can't enunciate and talk loudly or sing
Hmm.
loudly. They have to be real quiet like this because they can barely move their tongue. And they've compensated. They realize that if you barely move your tongue, you can sound more clear than if you're trying to talk loudly.
That is amazing because it make, you know, it just makes me like you were just saying quite exactly people come to hadn't thought about it like that actually. Obviously people come to me because they're having issues with their singing, they come to me because they're having these problems, and
Could be a third of the patients, or I guess your clients, or it could be even up to half have a tongue tie.
mm-hmm.
They're
it
seeking you out because they've struggled with their singing in the past and they're
mm-hmm.
not like progressive hitting a plateau.
Yeah.
That could be what's holding them back, possibly.
Yeah.
Not all cases, but a good percentage of them, more than like 1%, which like people would say that now, like, oh, like 1% of people have tongue ties. No, it's 25% probably.
Wow, that's so crazy. I think that a lot of well, I've now when they come into the studio, we do the test because I want to make sure that is
Yeah.
it about tongue mobility? Are they even going to be able to do some of the things that I'm asking them to do?
Yeah, you could have the best therapist in the world. Like, suppose you want to like run in the Olympics. You saw, the guy, are you from the UK or where are you
I'm
from?
from New Zealand.
New Zealand. Okay. I wasn't sure if like Australia or like, okay. South Africa sounded a little bit different than that. So New Zealand. Okay. Kiwi.
Hmm.
What's that? The guy, what's his name? Just broke the world record in the mile. He's
Hmm.
Scottish. So there's no way you're going to run in the Olympics, right? Or break. You can have an Olympic coach, the best speech therapist in the world, the best vocal coach in the world, if your shoelaces are tied together, if your tongue is held down, right?
Hmm.
If there's a physical limitation like that, like a mechanical limitation, you can't therapy your way out of that. Now, they can teach you to compensate. Like, here's some strategy.
Mm.
Like, for me, they taught me to back all my L's. So you're supposed to say like la la la. I said la 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 with the back of my throat. It sounds
Ah.
similar, but it's different, and it's actually not the correct placement for that sound. L should be made from the front, not la 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 in the back. And so
Hmm.
now when I'm trying to use Siri or something like AI to dictate something, if I say a word with an L in it, it'll think it's like a W sound. Like if I say light on the sauce, it comes out like white on the sauce, like white sauce instead of light on the
Hmm.
sauce.
Hmm.
So, but because they taught me, and for 30 years, or I'm 40 now, I compensated and yeah, did the wrong placement for my speech. So anyway,
And that's exactly what, that's exactly what we talk about with singing is that, basically the idea is that you need to get the back of the tongue as high as
yes,
possible in
that'd be
order
the tongue tie.
to win the resonance space here at the back. And so
Yeah.
Is that even possible to bring the back of the tongue forward if the midsection of the tongue, for example?
Very difficult. Yeah,
Okay.
very difficult. And so that would be like a less obvious tongue tie. So what's interesting is some people come to see us to the tip tongue tie and they have
Mm-hmm.
perfect speech, like articulation. Now they probably have like vocal fatigue and that kind of stuff. They might have sleeping issues or eating issues, but sometimes they have perfect articulation.
Mm-hmm.
And so the pediatricians see that they say, oh, well, Johnny had a to the tip tongue tie and perfect speech. So then tongue ties don't cause problems. That's a logical fallacy. So for Johnny, it didn't cause a problem, but for Sam or for Zoe, it might be a problem
Yeah.
because of, and it could be less obvious. It could be halfway, and for Zoe, cause a problem. So
Mm-hmm.
it's really individualized. So not like every tongue tie needs to be fixed, but I mean, if it's causing a problem, I think just at least letting people know that this is a fixable item. Now, if they come to you for singing troubles, but they also have sleep troubles, they can't breathe at night, like it's choking them, like sleep apnea, obviously, that'd be the extreme of that. But
Mm-hmm.
before that, it's just mouth breathing, just snoring, sleep disorder breathing,
Mm-hmm.
right? They're tossing and turning. There's all kinds of things, like night terrors in kids, bedwetting in kids. Um, you can go down, there's a whole list. But yeah, just even mouth breathing alone will decrease your quality of sleep. And then if you have decreased quality of sleep, then it's harder to pay attention during the day. And the kids will get hyperactive and they
Yeah.
can get aggressive behavior or anxiety. That's why that guy in Zach Brown Band, his anxiety went down. When we released his tongue tie, it helped with the parasympathetic, so like rest and digest.
Mm-hmm.
Also, it helps you sleep better. So all these things are all connected. So again, if they're coming to see you for singing, plus they have the eating stuff like slow eating or picky eating or trouble swallowing
Mm-hmm.
pills, plus they're on a CPAP or they have an oral appliance they wear at night, or they have sleep troubles, plus they were a difficult baby or a colicky baby, like the more things you have, the more likely it is you have a restricted tongue. Doesn't have
Mm-hmm.
to be to the tip, it's probably not. Ideally, if it's to the tip, they would have picked it up by the time you're an adult, certainly. But we have
Actually,
grandparents come see us and it's to the tip, or the adults will come see us, it's to the tip. Say, do I
uh-huh.
have a tongue tie? And they can't lift it at all, you
Mm-hmm.
know? They didn't know when they're 30 years old or 50 years old. Go ahead.
Oh no, I was just going to say you'll be. I was quite shocked actually when for the first time ever in my life when I moved to Germany, I'd actually witnessed adults or teenagers with to the tip tongue tie because in New Zealand that would be something that would have been looked at when they were babies, but
Yeah.
here there's this they're very anti any type of sort of surgical
Intervention.
intervention. I mean,
Yeah.
I use surgical in a very big way. I mean, it's lasered off, but
Yeah.
the yeah to the tip, and then they sort of said, oh, I've got no issues, but their tongue, even when they're speaking, rolls in a really funny way. You were also explaining in the book about the long face ending up with
Yep.
the small sinuses, sinus issues, chronic hay fever, and those sorts of things. What are
Yep.
some
Yep.
other
High
sort
arch
of
palate. And like with glasses, like you think you see normally, like I can see
hmm
pretty well. I'm fine because you don't know any different. Then you put on glasses, like, whoa, like
that's
I did
crazy.
not know that like there's leaves on the trees. It talks about in
hmm
chapter one, you know? So
I
yeah,
really
there's
love that analogy actually because that's one that I've been using with people because
yeah.
I think that for us, like for actually for I think for everybody that you would never say, "Oh, you need glasses." Don't. That's way too much.
Yeah, yeah, like well, don't do glasses. No, no. Like just let them like just sit them at the front of the class. I give them extra time on tests. Like, no, just give them some glasses. Like
Mm-hmm.
imagine your fingers are stuck together. It's called syndactyly, right? Like webbed fingers. And there's a lot of kids that are born like that. No one ever debates like, should we release it? Should we cut their fingers? What if they're not going to be a concert pianist? Like they don't need all their fingers. Like, no, like you cut it. But what's problem is, especially here or in other places, they're clipped at the hospital, right? They
Mm-hmm.
clip it or snip it, and then like it doesn't get much better. Well, what happened? So they took that and they just cut it halfway. And so it's
Mm.
still restricted. So if the plastic surgeon did that to your hand, you'd be like, or your child's hand, you'd be like, you didn't get it all, right? It should be released. But in the
Mm-hmm.
mouth, you don't realize how far back it actually goes. And so to do it right, they have to get a full history. We have a 50-item questionnaire. It's on our website, tonguetie.com, or
Mm-hmm.
tonguetieal for alabama.com. But tonguetie.com is a bunch of stuff on there. So there's a
I'll put
50-item
all the links in
questionnaire.
the
Well,
description.
yeah, yeah. So, I mean, if you have more than a few of those check marks, like there's a good chance. But most people think it only affects speech. And for babies, it's only the weight gain. As long as they're gaining weight, it's fine. Don't treat it. They're really like anti-interventionist here too. And so they're like, oh, they'll be fine. Yeah, they'll live, but like we want them to thrive, right? We
Mm-hmm.
want the mom happy and able to breastfeed if she wants to, and without pain, right? There's all these things that goes into it. So you have to do a good history, getting the story from the mom. So we would do that first, and then you get a good examination. You got to check the lip, check the cheeks. You have cheek ties, you have lip tie that can affect BP, M, and W sounds. So it's not just the tongue. There's lip tie, there's cheek ties up in the cheeks, lower cheeks, very rare, and then the tongue tie, and then the lower lip tie, very rare again. So most of the time it's like upper lip tie, a tongue tie, maybe upper cheek ties.
Mm-hmm.
So we'll check all those things. We'll check the tension on the baby. We'll check, the child. And then you have to do a full release. So you have to get all the tissue out of there. Now, when you use a laser, we can dissect like very carefully and get every individual fiber and make sure it looks great. For older kids, like teenagers and adults, we would suture it. So you get a diamond shape and you bring it together like that.
Mm-hmm.
And then, so were you stitched or sutured when you had yours
Yeah, I
done?
was. Yeah, I had
Yeah.
like, I think it
And
was
so that
like
can help.
10 or 11 stitches actually.
Yeah, yeah. So you stitch it together typically, but the younger babies you don't have to. And then you can do all that right, but if you don't follow up with the patient
Mm-hmm.
and see what happened, whether they got better or got worse or change their surgical technique, then you're going to miss out. And then the real key is aftercare. So if you don't do stretches, again, you could do all that stuff right. They have perfect release. You don't
Mm-hmm.
do stretches. So even with stitches, you have to stretch.
Yeah.
That's a common misconception. People think, oh, it was stitched, I don't have to stretch. No, you still have to stretch it out. Otherwise, it'll still contract
Mm-hmm.
and it'll be better than it was, but it's not as good as it could be if you do stretches and you get full mobility of the tongue,
Mm-hmm.
especially getting the back of the tongue up. If you want to get the back of your tongue up, you have to have full mobility of your tongue. So we recommend stretches twice a day for children and adults. Firm, pretty like a good pressure under the tongue and lifting it back like that. So it's if this is your tongue, push down first and then back and then hold it all the way.
Mm-hmm.
Otherwise, it'll start sticking back together right here in the middle. And so twice a day, about 6 weeks, possibly longer. If you notice it gets tighter, just give it another little stretch. But anyway, I hope that's helpful. So you have to do all those 6 steps right, or else it won't work as well as it could work.
Mm-hmm. No, I find that super helpful because I think that's one of the things that I couldn't find online actually, even when I have a couple of students who are getting ready to have the tongue tie, but they are being seen by a myofunctional therapist as well to get them sorted for that. And the
Yeah.
the aftercare and the stretching is not something that's something they'll go through with the myofunctional therapist, but it's not really available online actually for
Yeah,
people.
yeah. And so the Maya will give you like exercises to do, like a
Mhm.
suction hold, like clicking
I
noises,
love that one.
like your tongue left and right, that kind of
Hmm.
stuff. They'll give you those exercises. But like the wound care typically comes from the surgeon. But some people, again, they don't get the patients back for follow-ups. They don't see it stuck back together.
Yeah.
And we see it in babies because we leave the diamond open and it'll stick right back together within like a couple days.
Wow.
So imagine like if you got your ear pierced but didn't
Hmm.
wear the earring, what's going to happen? It'll just close back up, right? You cut your hand, it should close back up. So that's what's supposed to happen. We're trying to trick it to heal open though.
Hmm.
And so to do that, you have to stretch it out pretty firm pressure about twice a day. If it doesn't seem to bother the child, or if it, sometimes like if we did like dads, we like, mom, you got to stretch him. It's like stretching with a partner. I might go like, okay, stretch a little bit. And then someone else, oh, okay, that's good. You can stop now. You can stop now. Right?
Hmm.
You want to stretch to that point where it's like uncomfortable. If it's not uncomfortable, you're not stretching hard enough, basically. Shouldn't be painful, but like it's gonna be, you can stop now. That's good.
Hmm. Oh
So,
no, it was definitely what did my surgeon say? She said, "Go it should be fairly painful. Go to the point where you're just like, oh, but make sure
yeah,
you're
I don't want to
sitting
do it
down."
anymore. And then hold it for maybe 10 seconds or so, and then yeah, twice a day. And then the myofunctional exercises typically a couple times a day too.
Hmm. No, they're absolutely fantastic. What are some of the other symptoms that maybe an undiagnosed adult might be experiencing? If they're sort of, we're talking about
Yeah,
restriction of the tongue, and you've said sleep problems, sleep issues. I find this idea of breathing issues quite
yeah,
fascinating.
no, for sure. It's easier to breathe afterward. It's the fascia.
Hmm.
And also if your tongue is held down and then a flop back in your airway while you're sleeping. So it should
Hmm.
be suction cup up on your palate. So if right now you're listening and your tongue is held down, you may have a tongue tie, like a lower tongue posture. It should be resting, not just the front of it, but the whole thing up on the palate.
Hmm.
But anyway, trouble swallowing pills, headaches, neck tension, TMJ problems, teeth grinding. There's all kinds of things. There's about 50 items for adults. So and we don't treat adults anymore, just babies. Adults complain more than kids and babies. So
I can imagine, but it's, obviously there, from what, especially from the surgeon that we there aren't that many surgeons that do it in, that
yeah,
operate on adults in Munich. And there's this
yeah,
one
oh yeah, for sure.
particular, yeah, there's this one particular woman. I think her waiting list, it's like an 8 month wait to get
Oh
in as
my.
an adult. Yeah.
Yeah, yeah. And so it's hard. So I went to see Dr. Zaghi, his friend of mine. He's in Los Angeles. So I flew
Hmm.
out to him. He did actually did my own years ago. So if you want something done right, do it yourself. So I did my
Wow.
own. I did stretches. I did myo with it, but still it stuck back. And so I went and see my buddy Dr. Zaghi, and he did it for me and stitched it up. And I did more myo, and then I did stretches for like probably 4 months. I mean, I
Hmm.
did a long time of stretches, not like crazy, but like I would do it in the morning, and then because at night it's sitting still. During the day you're
Hmm.
moving around, you're talking, you're eating, all that stuff. But I'll do a good stretch in the morning, probably up to 4 months or so, just to make sure I did not want to do it again. Right. The only thing worse than like 4 weeks or 6 weeks of stretches is having to have it done again and then 6 more weeks of stretches.
Hmm.
So even if they say don't stretch it, you definitely have to stretch it. It's like yeah, it's very basic 101. If you got your ear pierced, it's gonna close back up if you don't wear the earring. So
Yeah, absolutely.
the stitches they fall out in like 3 to 7 days typically. So
Yeah, they sort of started to dissolve and sort of fall out as it was kind of going along. I didn't actually find the procedure afterwards to be painful at all. Um,
yeah, it's variable. It depends how deep you
okay,
go and how much
okay.
muscle is taken. The method, was it a laser or scissors
It
or how'd
was
they
a
do it?
laser, yeah.
Yep, yep. So there's different types of lasers. We use a CO2 laser.
It was
There's
one of
different
those, yeah.
brands. Yeah, there's CO2 lasers, so there's different brands depending on where you are in the world.
Hmm.
Like in Australia, I'm not sure about New Zealand, possibly if they're the same, but light scalpel, that's what we use. It's in the US, Canada. It's not really in the EU. There's lots of restrictions around
Okay.
medical devices and stuff. The EU is very difficult. Um, then there's like diode lasers. It's like a hot tip, and that just burns the tissue versus the CO2 laser vaporizes the tissue. So
Wow.
CO2 gets to about 100 degrees Celsius, so the boiling point of water, and it just turns to steam or water vapor, so it vaporizes. A diode laser gets to 700 to 1,000 degrees Celsius, and so then that's going to burn the crap. It's white hot, and it just burns the tissue. And so you're not going to, you might get more scarring with the diode laser. We did it with a diode laser for about 18 months, but it was just very difficult for babies and kids, younger kids like we're doing. So we switched to CO2 and never looked back. That was just over 10 years ago. So it's 2016.
Wow.
And the book is 8 years old now, which is hard to believe. We wrote this in July of 2018. So last week was the book's birthday. Happy birthday.
Happy birthday, book. That's
Yeah,
very
right.
exciting.
So, but yeah, so you can do it with laser. You can do it with scissors, certainly. Dr. Zaghi did a lot with scissors. Lots of providers still use scissors. Um, they were taking more muscle, and now they're kind of more conservative, taking less muscle.
Hmm.
Still seeing really good results. The key is not like how deep you can go. It's just we got to get the function back in the tongue, so you can lift up the whole way, essentially. So once you can lift up the whole way, then you stop.
Okay.
But anyway, you can do it with yeah. There's all kinds of different instruments. They used to actually use a sharp fingernail. So midwives would use a sharp fingernail to release the tongue in babies back in the day because they weren't allowed to use instruments. And
Wow.
then like King Louis the 13th was of France was tongue-tied. It's in the Bible, Mark 7:35. The string of his tongue was released and he spoke plainly. Some of the earliest Japanese writings mention tongue tie. The Quran mentions tongue tie. So it's not like a new fad. There's some stuff in the book of like, from 1666, 1620, like wood cuttings. I mean, it's pretty crazy how, it's been around a long time, but just more awareness now, like podcasts like this,
Hmm.
social media, that kind of stuff.
And I think that, and that's why I immediately wrote to and I said, you know what, I think that more singers need to know about this because
Oh
one
yeah,
of the things that some of my singers that we now know, and it's not, I haven't diagnosed anyone, I've done the test and I've said, I think you might have one. Now you need to go and see a professional, like someone like yourself, or a myofunctional therapist or a speech
yeah,
therapist or a dentist to go and get the proper diagnosis. And they've still
yeah,
said, oh, but Zoe, I don't have the pain that you've experienced. Or like, because I had quite a lot of vocal fatigue, quite a lot of general head and neck
yeah,
pain. What would you say to, say, a patient that, I mean, you said that you don't treat adults anymore, but you have done.
I've
What
done
would
a
you,
lot of adults in the past,
okay,
but
yeah.
yeah.
So what would you say to a patient who comes and said, but you know what, Dr. Baxter, actually, I'm not experiencing the same level of pain that you're outlining in the book.
Yeah, so I would look at the whole symptom questionnaire because it often is things you don't realize, like constipation. Well, yeah, I've had that forever. Reflux, the sleeping problems, right? So you don't have to have pain with vocal fatigue. And it's always up to the patient whether they want to do it or not. Some
Mm-hmm.
people have to the tip tongue tie. You tell them, and they're like, no, I don't want to do that. Or for their child, like, it's to the tip, mom. I'm like, yeah, he's fine. We had a doctor in here the other day, with her child, and I said, like, it's pretty tight. It's like to the tip. Are there any problems? Nope, he's fine. So in a certain sense, you can lead a horse to water, but you can't make
Mm-hmm.
him drink. And so we never like talk people into it. They have, patient autonomy, certainly. It is sore. It is a, medical procedure. It's nothing like getting your tonsils out. That'd be way worse.
Mm-hmm.
Um, and so for kids, it takes 5 seconds to 10 seconds to do the procedure. Adults take a little bit longer, a couple minutes, but then maybe 10, 15 minutes to suture up. So we don't put them to sleep. We don't put babies to sleep or sedate them, nothing like that. Um, but all that to say, I think that the symptoms are the key. And so if someone's really not having any symptoms or many symptoms, you might just watch and wait. But again, if they're coming to you for singing help, it's like your shoelaces are tied together. That's the best analogy I could think of. You're not going to run. I ran 10 miles this morning. There's no way I could have done that with my shoelaces tied together.
Yeah.
I could hobble along the track, but I'm not going to get anywhere. I'm training for a marathon in October,
Mm-hmm.
but I know I need to come over there to Berlin. That'd be a fun marathon. I've heard that's a good one, one of the majors. But all that to say, yeah, the symptoms are the key, and we don't talk people into it. Sometimes they come back years later and like, you know what, you told me about the tongue tie in like 2019, and we got busy and stuff happened, but like we want to get it done now for Johnny.
Oh,
So sometimes
cool.
they come back years later and want to get it done because now
Mm-hmm.
they see the symptoms there. So
I'm definitely gonna be like passing over your symptom list to everybody and be like, okay, are you
yeah, yeah.
experiencing more of these? I mean, I feel like this might be a silly question, but does hypermobility mask some of these symptoms of the restricted tongue movement?
Yeah, it can. It's like Ehlers-Danlos symptom. A lot of people have Ehlers-Danlos. There's different types and stuff, but like
Mm-hmm.
hypermobility type specifically, it can mask some of it. Like if the floor of the mouth is like lifting up a lot, then your tongue can be restricted, and then you're getting all that mobility from the floor of your mouth.
Mm-hmm.
So that's certainly possible. Sometimes there's like some weird wound healing because the collagen is a little bit different in people with hypermobility typically. Like my sister can do the splits like 3 ways. She's a yoga instructor now, but she's like
Wow.
extremely flexible. She can like, I don't know, all the things. So some people are just very flexible. Some people have really stretchy skin. They can pull. Some people, if you can take your thumb and put it to your wrist, I can't do it.
Mm-hmm.
But that's a sign of
Yeah,
Ehlers-Danlos.
that's the
Yeah,
yeah.
so you can, yeah, yeah.
Yeah,
So
yeah,
you're pretty hypermobile.
I'm
I can't,
definitely
I mean, this is as
hypermobile.
far as I can get. Like, no, I'm definitely not hypermobile. So anyway, it's
Because
hard to know.
oh, sorry.
Go ahead. No, I said it's hard to know. And like there's things like MTHFR. People talk about that. Why I'm like, I have like a gene mutation and
Mm-hmm.
methylene tetrahydrofolate reductase, so MTHFR. And so it talks about that a little bit in the book. Like, well, why are there so many tongue ties now? Is it from folic acid supplementation? Possibly, which thickens up midline tissues. So since like the 90s, 1990s, they started supplementing, 80s or 90s, they started supplementing with folic acid for babies and like prenatal vitamins. Genetics plays a role in it, certainly. We had a family yesterday. It was the third baby. Third one had a tongue tie. We had a family of like 8 people, and like all 8 had it. And then sometimes we'll have a family of 10 kids, and then the last one had it, but all the other 9 are fine. So it doesn't always run in families, but it can.
Mm-hmm.
So,
No, I was gonna say that the a lot of singers tend to be hypermobile because we
mm,
don't always know what causes or what is the reasoning behind someone becoming a good singer. But we sort of the idea is that it's a lot to do with the symmetry, but also the flexibility of the larynx and the structures. And so we tend to have singers who are they tend to be more singers that are hypermobile. And so that's when
yeah,
I was thinking of this idea of maybe hypermobility was something that is able to then mask some of these symptoms of the tongue restriction
possibly.
itself. Mm-hmm.
Yeah, I mean, we had another family came. I can't tell you who it was, but it was like very famous like Christian recording artist, and they brought their son to us, and so I like I often check the parents. I checked mom and dad. They're both, and dad's was like very tight. And he has a great voice and sings and like very successful musician, like to the tip tongue tie almost.
Wow.
Right. And so it's like, wow, like, some of these people, yeah, can have very restricted tongues and like still have a great career. So it doesn't mean you have to get it done, but, make it a little bit easier if you get it done. So
Does it
anyway,
end up changing then the way, I mean, there are the benefits of we're saying, okay, if you get it done, that it's going to be easier to breathe, your tongue's going to have more
yeah,
mobility. Are there are there other
risks.
benefits to having it done? Like when someone's had it in a career who's become an amazing singer, they're having, they
Yeah.
don't aren't presenting with so many symptoms.
I mean, so the risk is like, what if you change the voice a little bit? Again,
That's
that's
what I
your
get a lot.
instrument. Like you're like turning the tuning on the guitar, or like ah, it'd be hard. It'd be hard to know. So maybe he never came back to have it done. So I don't know. There's lots of people that have a tongue tie and they're like, well, I'm good with it. It's like losing weight. Like, if the traditional opera singer that's, morbidly obese, it's like, well, you lose weight, are you going to change your voice a little bit? And it's hard to know all those kinds of things. Certainly, if you change like the shape of the palate and like with the palate expander,
Mm.
you get your tongue tie done, you lose weight. All these factors can certainly affect the voice. You get your tonsils out, can affect the voice. That could be something to think about before just going out and getting it lasered. And then also finding someone who does this routinely. I would ask them, hey, have you done singers before? Do you work with a myofunctional therapist? If they say, what's a myofunctional therapist? I'd probably find someone else because that would probably be your first step is we want to find it's like a tongue retraining
Hmm.
person. So it's either like a hygienist, a speech therapist, a PT, an OT with extra training. And so if they don't know what that is, if you ask them like, do you recommend stretches afterward? If they say you don't have to stretch, it doesn't stick back together, you probably want to find someone else. You can ask them how many they've done. I mean, we've done over 16,000 procedures.
Wow.
So, I mean, we do a lot. I did 10 yesterday, right? And so it just depends. There's some certain questions. I think there's questions in the back of the book you can ask. Some of
Hmm.
them are more towards babies and children, but a lot of them would apply. Like, how many do you do a week? If it's like, oh, I do like once a month, that's probably not a large focus of their practice. If it's like an ENT, they want to do sinus surgery, it pays better. If they're a dentist, they want to do implants and crowns or orthodontics, braces. But yeah, I think there's some good questions to ask. And as far as like what could it make better, I mean, there's all kinds of things that can make better. It's like the neck tension, the headaches, the
Hmm.
migraines, TMJ problems improve, sleep improves. That's a big one. Breathing. So there's lots of benefits, but there are also risks. Obviously, you could have a nerve damage, you have some bleeding, you get a hematoma underneath there, like a complication under the tongue. Um, Salivary gland or salivary duct injury. We never see one get infected, but reattachment is the biggest risk.
Hmm.
And then paying the money and it didn't help as much as you wanted it to. It's like
Yeah.
financial risk would also be a big risk. But so I don't want to just paint it like, oh, it's perfect, everyone do it. I mean, there's variable success, but the
Hmm.
more like steps you follow, like as a provider, like getting a good history, a good examination, proper treatment, aftercare is key. Follow up with the patients. Those are really the key is it's not just cutting it. It's like the system and like around it.
Hmm.
So
I
anyway,
wish I'd known this when one of my singers went and I'd said she had to the tip tongue tie and I said, I think you're tongue tied. And maybe she was singing for like 5 years and she was really struggling finally. Like you were saying, you're not, you can lead the horse to water, but you can't make them drink. And she was struggling with these really high notes. And I said, I think it's your tongue tie. And then she went to the dentist the next day and just got it cut. And I was like, why did you do that? We needed
yeah,
to do the myofunctional therapy beforehand and all of this. She was like, oh no, I didn't get any stretches. He just took the scalpel and just went.
yeah, that's not ideal. So I mean, like yesterday we had a 3-day-old baby. They're going to do the best because they have 3 days of bad habits,
Mm-hmm.
plus about 20 weeks in utero in the belly of bad habits. You start sucking about halfway through pregnancy, which is wild. And then you'll have like a 3-month-old baby. So they'll do better than the 6-month-old baby. So the fewer bad habits and compensations you have, the better you'll do. So
Mm-hmm.
like the 2-year-olds, the 1-year-olds, a lot of people won't even treat them. They'll treat till about 3 months old babies, and then from there they'll wait till they're 4 years old or 6 years old. So there's this huge gap of like all the toddlers, the preschool age kids, kindergarten. They're not going to treat them, right?
But
And
why do
so
they not treat
they
those
just
that
wait.
group?
Like, oh, let's just wait till they're cooperative in four because if you can't do the stretches, it would not be worth doing. We figured out a way to do the stretches. We give people a mouth prop. Um, got one right here. So we give people a mouth prop, and you can put this in the child's mouth. Holds it open. You can do the stretches that way. But if you don't
Ah,
give someone this, like you can't stretch a 2-year-old, they'll just bite your finger off. You're going to come back like that, right? Like missing a finger. And so, yeah, we do all the babies, the toddlers. That's kind of our bread and butter, the typical one.
mm-hmm.
Some school-age kids, a few teenagers, and then no adults anymore. But
Okay.
yeah, so I mean, the thing is, like the singers, they hear this, like, oh my gosh, this is my child. He's the slowest eater. We can't eat out, can't eat meat. The person that wrote the Zungenband book or translated it for us, Maren Mittelhammer, she's so sweet. She's a pediatric dentist. She came to see us, and we just checked her son to the tip. It was like, or close to the tip. It was very tight. And before they even left the States to go back to Germany, he was already like eating better. He could eat his meat better and like sleeping better
Wow.
and talking better. And so for some people listening to this right now, even if they don't have a tongue tie, like it could be their child. Maybe that's why they're
Mm-hmm.
listening, or their baby. Like, why can't they nurse well? It's painful to nurse. They're colic, spitting up, they're gassy or tooting a lot.
Mm-hmm.
They're let's see, there's always so many things like trouble bottle feeding. So switching to a bottle does not magically solve the problem. And then they get older, it affects crawling and walking, speech delay, slow eating, gagging, trouble with solids. So if this is your baby, like get assessed by someone that knows what they're talking about and not just like, oh, ask the pediatrician, ask the dentist. They'll say, yeah, it looks fine. Because that's not, it doesn't matter how it looks, it matters how it's functioning.
Mm-hmm. I think that there's what I've come across, especially in singers and the ones that I have who have now had a diagnosis, and is also what was going on in my own my own tongue was definitely pitching difficulties, having that
Mm,
problem of basically getting the larynx high enough
yeah.
in order to be able to pitch. But like whenever we were using an increase in subglottic pressure of basically just constantly pitching under or often not being consistent with the tone.
Mhm.
And the inconsistency was definitely
And it's
what
better
I
now?
experienced.
Yeah,
Heaps
now that you
better.
understand? Yeah,
Yeah. But a
that's
lot of
awesome.
retraining had to go into it. Definitely had like
Yes, you
lots
were
of singing
compensating.
lessons. Yeah.
You were compensating, like trying to do all these things, work around it instead of just like, yeah, release the tongue and then. But you didn't know, I'm sure. When did you find out you
I
had a
only
tongue tie?
found out a year ago and I'm 38.
Wow. Yep. Yep.
Yeah.
So I had mine done at 30 for the
Mm-hmm.
first time.
I wish
Um,
that, I mean, there was a lot of anger there, I tell you. There was a lot of problem because I was like, why didn't someone notice this
I
when I
know.
was younger? And
Was yours like halfway or to the tip or
yeah, no,
how?
mine was halfway.
Yeah, so not obvious. So those ones go undiagnosed pretty frequently.
Hmm.
And like in babies, I'm not sure if you have like a difficult baby or like a hard time nursing as a
Yeah,
baby.
I
You can
was.
ask your
Yeah.
mom, but
Yeah.
so
I couldn't
often the ones that are,
breastfeed.
yeah, so often the ones that are less obvious have the harder time breastfeeding. So those ones don't get picked up. So
Hmm.
they see the ones that are to the tip and they'll clip it. Well, now they've turned it into a halfway tongue tie.
Wow.
And so a lot of people are like, oh, my baby is already fixed. We had one yesterday, just yesterday. They said, well, they clipped it already at the hospital. Looked in there. They didn't mess it up, but it's not as good as it could be. And you're still having all these tongue symptoms like
Hmm.
terrible nursing pain and all that kind of stuff. So
Wow. Is it
anyway,
worth
but yeah,
saying like an adult getting it like an older individual, say like a grandparent who's
yeah,
having like all these
sleep
basically
apnea.
all these issues that I'm sure
Yeah,
there's lots of
headaches,
older people.
migraines, poor
Uh-huh.
sleep problems. So I mean, the oldest we did was 70, like 700
Hmm.
years old. The youngest we've done is 12 hours old. So they were born at 10 p.m. and we did them at 10 a.m.
Wow.
So we love the little babies; they're sweet, but the grown-ups need help too.
Hmm.
There's a lot of things. So look into Dr. Zaghi, the Breathe Institute. He has a
Hmm.
few studies that he's put out on tongue tie recently. He has like 100 or more papers published, but recently he's has some good papers published on adult tongue tie and
Hmm.
like less neck tension and sleeping better and breathing better and that kind of stuff. So he's really like pushed this field forward as far as adult tongue tie treatment goes. So thankful for him and to call him a friend. But yeah, you can look for like people that have trained with him. So it'd be like a Breathe Institute affiliate or a
Hmm.
Breathe ambassador is like a lesser, like you just attended a course, it'd be a Breathe ambassador. The Breathe affiliates, he's like traveled out to them, watched them do it. They've come to him, watched him do it. So anyway, and then anyone interested, they can check out the book Tongue Tied. It's an easy read. We have in whatever language people speak, most likely. So
Absolutely. I'll definitely put the link below because I just think I wanted to thank you so much, Dr. Baxter, for coming on the podcast today because I think that it's going to help plenty of singers out there who are maybe confused about their symptoms, also singers who having children and that part of tongue tie as well, and also for my biggest thing is also to see other singing teachers learn more and other voice professionals learn about
yeah,
this because we have these tongue-tied individuals coming into our studio, and I think it's important
yeah.
for us to learn about what those symptoms are so that we can notice these things in our singers.
I mean, I would check every new client. I mean,
Hmm.
we just use the adult symptom checklist. I mean, if you're going to spend time doing all kinds of assessments with them, so I'd have them just fill it out. It takes about 5 minutes to fill it out. If they have more than a few check marks of symptoms on there, it'd be worth talking to like a myofunctional therapist. Um, Otherwise, you're going to do all that training, like you said, then you have to retrain them once it's fixed.
Yeah.
So, and even if it's halfway or a quarter of the way, it doesn't have to be to the tip. That's probably the biggest message. It doesn't matter what it looks like. It matters like how the tongue is functioning, and it's
Hmm.
different for every individual. So, but yeah, they can learn more at tonguetie.com. We have courses for providers. So if there's like a dentist listening that wants to learn how to do it, or we have a course at our office. We just had one on Friday where people come and they learn from us. We had a dentist from England, from Siraj from London came, and then we did a joint course
Was
in
he from the
Atlanta.
London Smile Clinic?
Happy Kids
Okay.
Dental. Yeah, Siraj Vatish. Yep. So we did a course actually together, kind of tag team. We actually may do a course in Madrid for other people that are in Europe in November. We're looking at that. And then I'm doing one in Barcelona next year. And then Tongue Time is going to happen again next summer in Switzerland. So that's not
Wow.
too far for you, but you may want to look into Tongue Time. I'm not sure I'll make that one. It's in, I think, July. It's around this time next summer in
Hmm.
Switzerland. Should be very nice in St. Gallen. But yeah, tonguetime.ch, I think is the website. But
Fantastic.
anyway,
That is
yeah,
absolutely amazing. Wow. I cannot thank you enough, Dr. Baxter. And I can highly recommend the book, especially for any vocal professionals out there, because it was just so fantastic and really, as you said, an easy read. But I love that everything that you said was backed up with research, was not just
mhm.
your opinion. You've also gone and
No, no.
it's extremely well researched. And it was a wealth of knowledge. And I want to thank you so much for your time.
Yeah, I think there's like 118 references, and then like, and
Hmm.
if you're, and this is 8 years old, and like so far there's nothing. I was looking through it the other day, like there's nothing in here I'd really change at all. Like, I mean that means it's true.
Yeah.
A lot of stuff, changes over time, but. Not saying everything in the book is like 100%. We're not going to find out new information as it goes, like new evidence and new research and new protocols. We've certainly changed up how we do some things. We used to do stretches 6 times a day. Now we do them 3 times a day for
Hmm.
babies. But for the most part, yeah, everything is still like exactly what I would say today. So I'm glad it stood the test of time, at least for, almost a decade. So, but thank you so much, Zoe, for
Absolutely.
having me. It's been a pleasure to be here. Thank you for the invite.
Thank you.